Hello again. This is me. I am here for your infertility needs. Now, many of you have come to us with inquiries as to the definitions of terms and acronyms that we have used in our videos. Well, I'm here to educate you, not on everything because I'm not an expert, but I will tell you about things that we've used and things that you may not be familiar with. My qualifications are as follows. Women's health class at Brigham Young University. Had a mom, 3 sisters, and I'm married to Carissa. That should be enough. So here I am to talk about male, but mostly female reproductivity. Some of the terms that have been sent in to us. The first one, and I'd like to talk about some general terms.
He doesn't drink at all.
I would like to talk about some general terms before we get into the more specifics of the procedurals, the actual nitty-gritty, if you will. And I will, so as long as you will, we will. TTC. You may see this one a lot of places. Instagram, Carissa likes to use TTC. There's TTC Sisters. It stands for trying to conceive, which we are. Any questions? Okay. The dreaded time period between insemination and pregnancy test is known as the 2WW, 2-week wait. Am I correct in that? The 2-week wait. Dreadful, just dreadful. Terms that we use for those of us in the infertility community. AI does not stand for Allen Iverson or Andre Iguodala. It stands for artificial insemination. Now there's a variety of forms of artificial insemination, the one of which we have experienced, or should I say Carissa has experienced, because when we do it, it is officials insemination.
Oh my gosh.
It is not artificial. But artificial insemination can be an IUI, which we'll talk about later, or IVF, which we are not to the level of. Those are forms of artificial insemination, or AI. The next 2 terms are the results that you can get from your pregnancy test, your at-home pregnancy test, AHP, at-home pregnancy test, AHPT. There's the BFN, which we have experienced, and many of you have numerous times, the dreaded BFN, big fat negative. And there's the one that we're all waiting to see, the BFP, the big fat positive. Yeah, not to be confused with fat potential. Okay, now getting into the nitty-gritty science, Carissa and I have tried naturally. We have tried with the herbal stuff, and we are trying to go the AI route now. That's kind of the next step. And with that is involved a variety of techniques prior to the actual insemination method. Many of you are familiar with CLOMID or letrozole or FEMRA, very similar. Essentially what they do is they're taken orally and you're telling your brain to create FSH, or follicle stimulating hormone. So you're telling your brain to create the hormone, which leads to your follicles in hopes that they grow, mature eggs. Am I right? Am I right? If I'm off base, ladies, blame my teachers. So that is follicle stimulating hormone. That is CLOMID, FEMRA, letrozole, oral medications. The hope is that your brain is in good communication with the rest of your body and you create the proper levels of FSH so that you create follicles. Now, a follicle is simply where an egg is housed. If I'm understanding correctly, you hope that your follicle is mature. When you have a mature follicle, you ovulate and it goes out of your ovary and into the fallopian tube in hopes of being inseminated. The struggle for a lot of people is follicles aren't mature enough, she didn't create enough FSH. So that's kind of the trick of the oral medication. We went in for a ultrasound to see how her follicles responded, if they matured, if they were big enough. They need to be a certain size in order for the doctor to do the artificial insemination. If they aren't, you have to try next month. We had that happen. The follicles weren't big enough, so we had to try another month. If your follicles are mature enough, the doctor will prescribe you an HCG shot. The HCG shot is essentially a trigger shot. It triggers your ovulation. Now, HCG stands for human chorionic gonadotropin. Let me say that again. Human chorionic gonadotropin. That's to have your ovary release the egg, ovulation. And then she hopes that she gets inseminated by the guys. Let's go to the guys' side. Now the guys have what's called a semen analysis done, where they take a sample of their items and have it tested for 3 things: sperm count, sperm motility, so the movement of it, if it's going to be a swimmer, if it's going to swim where it needs to get, and sperm morphology, which is the shape and size of the sperm. So all 3 of those things need to be at a certain threshold in order for it to not be considered a male factor in fertility. So the IUI happens next. If the male sample is good, then the doctor will prep the sample and the IUI will commence. Now the IUI, from what I hear, is not painful at all. It does not involve any invasive procedure. Just kidding. I'm sorry, ladies. It does. That is insensitive of me. The IUI, from what I see on my wife as I'm watching this man insert things, he inserts what's called, or she, a speculum. It's these metal, it looks like this. It's about this size, okay? It's like this, right?
Yep.
It goes in and it opens up the canal so that the doctor can reach the uterus. Straight through the uterus, right? It goes past the cervix. It opens the cervix and goes straight to the Apparently it's very painful, and especially as it sits in there and you have to wait. But the doctor will insert the sample, the semen sample, and it goes straight in. You want to make sure that if you have other things such as endometriosis, which is a irregular lining of your uterus, that you get that taken care of. Carissa had some of it removed and grow back, so you want to make sure that that's not an issue for you. And again, we're not medical professionals here, so seek out your doctor. If you think you're going to have a hard time, seek out your doctor. We're just trying to inform some folks here. The semen is inserted, and Carissa and other women must sit there with this thing opening. It does not look comfortable, and she must sit there for like 15 minutes. So she watches The Office. I try to I don't know what to do. I don't know what to do. I don't know what to do. Once that is done, the speculum is removed and you're on your way. You may have some pain the rest of the day. Carissa usually does. And then you wait. You wait till you take an at-home pregnancy test. You may have some more blood work done and hope that you get a BFP, that big fat positive. So that's the process with the oral medication and the IUI, the intrauterine insemination. But going back to the second step, so the medication, the letrozole did not work for us. The letrozole, FEMRA, CLOMID family did not work for us. We tried that a couple times, 3 times unsuccessfully. We weren't getting enough mature follicles created, stimulated. The IUIs didn't work. So our doctor has upped us to where we are now in FOLLISTIM injections. Now FOLLISTIM is kind of what it sounds like. It's follicle stimulating hormone. It's basically the FSH that your brain is telling your body to make. You're just bypassing that communication. So the FOLLISTIM is injected into the pooch area of the woman, and the idea is that it creates enough mature follicles. It has your follicles get to a certain size. We did this recently with our first round of FOLLISTIM, and we got 3 mature follicles, like 3 big size follicles, which is awesome. That meant, I guess, a possibility of triplets, because all you need is 1 follicle, mature follicle. We had 3. We had the HCG shot done once we were made sure that those follicles were big enough. The HCG released the egg from the ovary, ovulation. The next day, the semen sample was then distributed through the IUI, and then we waited again, and we got a BFN, a big fat negative. We were very hopeful that it would be positive because Carissa was experiencing changes to her body, which was part of the medication. That's part of what the doctor said may happen. She was taking estrogen pills to help condition the lining of her uterus, and it didn't work. So we are now on our second round of FOLLISTIM, and we're hopeful that we get just as many mature follicles again, and that this time the intrauterine insemination works, and that we get a BFP, a big fat positive. If there's other terms that you see that we've used that you're not familiar with, please let us know in the comments. Feel free to ask us, reach out on Instagram. Carissa's good about responding to people on Instagram or on YouTube. At Carissa Barzee is her Instagram. Thank you for being patient with a male. Hopefully it's not inappropriate for me to talk about this. Some people think that it's kind of cool that I know this much stuff about women's health. It's been good to learn some of these things again and to expand my knowledge, and I hope that it's been enlightening. Don't forget to like, comment, and subscribe, and we'll see you on our next video. Toodles!